like to thank all the co-authors and collaborators involved in this research. We have no conflict of interest to disclose. I would also like to thank the organizations that funded our research, the National Cancer Institute, and we also received support in part from the National Institute of Minority Health and Health Disparities. So the main research question for this abstract that I'm presenting today is we wanted to explore the prevalence and patterns of cannabis use in cancer patients who consume cannabis during active cancer treatment compared to those who did not consume cannabis during their active treatment. As we all know that with the changing landscape around cannabis legalization, the growing trend of normalization, as well as the availability of different products, and also the growing scientific evidence around cannabis, there has been a rise in cannabis use among cancer patients and survivors in the US as well as globally. And as of November 2023, cannabis is legal in 38 of 50 states, 3 territories and Washington, D.C. for medical use, and 24 states, 2 territories, and D.C. for recreational use. So as I said, with growing evidence, the cancer care team as well as the patient themselves are integrating cannabis as a part of their treatment, mostly to manage the side effects as well as the symptoms that are associated with cannabis, such as pain management, decreasing stress, anxiety, and other symptoms such as nausea, vomiting, and also to improve the sleep patterns. However, there still exists a gap in the understanding of how these patients are consuming cannabis in the oncology setting. Therefore, we wanted to take this opportunity to explore the patterns as well as prevalence of cannabis use in this patient population. So our study population comprised of cancer patients who were 18 years or older, seen at the Sylvester Comprehensive Cancer Center at the University of Miami within the last 5 years. We recruited the participant via phone, My U Health Chart, which is an electronic health portal of the U Health system, and also the direct contact with the cancer care team. We administered an anonymous survey via RedCap between October 2021 to June 2023. And the cannabis use classification was done by a self-report. So those patients who endorsed consuming cannabis during their active treatment were classified as cannabis use during treatment, whereas those who reported using cannabis in their lifetime but not during their active treatment were classified as no cannabis use during treatment. And we employed descriptive statistics as well as bivariate analysis to compare these patterns between the two groups. Our sample size comprised of 385 cancer patients who were in active treatment. The mean age in the overall sample was 49.5 years with a standard deviation of 15.9. 53% of participants were male, 41.6% were Hispanic, and the majority of our study population was non-Hispanic white, which was 47.5%, and also Hispanic Latinx accounted for 41.6%. And individuals, the cancer patient who consumed cannabis during active cancer treatment, their prevalence was 41% in the overall sample, and 73.5% of the cancer patients were born in the US. A larger proportion of our study participants were diagnosed at stage 2, which was 28.6%, followed by stage 3. And when we looked at the difference in endorsing cannabis use during their active treatment, we found that stage 4 patients reported higher cannabis use during treatment, which was at 60% as compared to those who did not use cannabis during the active treatment. A larger proportion of our participants reported chemotherapy as their treatment modality. That was 70.49%, followed by surgery, immunotherapy, and radiation. We also found that 53.3% of those cancer patients receiving radiation therapy reported cannabis during active cancer treatment, compared to 42.8% in chemotherapy and 36.4% in immunotherapy or surgery. A majority of our cancer patients reported breast cancer as the diagnosis, which was 16.62%, and we also found that the cannabis used during active treatment was also more, there was a higher prevalence in those with diagnosed with breast cancer. That was 15.82%, followed by lymphoma, 7.59%, and brain cancer and prostate, which was 6.9%. We also had the opportunity to inquire about the cannabis use sources, and we found that in regards to the cannabis initiation, in regard to diagnosis, we found that 71.8% of those who were consuming cannabis during their active treatment started using cannabis before the treatment, as compared to 44.1% of those who consumed cannabis before the diagnosis, who were not under the active treatment. And interestingly, we found that 35% reported that they acquired cannabis from their friend or a local dealer. That was 35% among those who consumed cannabis during the active treatment, as compared to 24.1% who did not consume cannabis during their active treatment. And also regarding the healthcare providers' recommendation on acquiring cannabis, we found that 51.6% did not have a recommendation from the healthcare provider, especially among those who were consuming cannabis during the active treatment. And regarding the reasons for using cannabis, we found that the top 3 reasons for using cannabis in those who were consuming cannabis during active treatment was depression, alleviating symptoms of mood disorders, as well as pain management. Regarding consumption methods, we found that among those who were consuming cannabis during active treatment, 60.6% endorsed that smoking or inhalation was their primary consumption method, as compared to among those who did not consume cannabis during cancer treatment, the method that was more prevalent was eating or drinking in that group. So we also asked about their recent use, and we found that 37.1% of those cancer patients who were consuming cannabis during active treatment reported using cannabis within the last week, whereas among those who did not consume cannabis during the active treatment, their last cannabis consumption was in the last 6 months. Regarding the dominant cannabinoid, we also asked patients about what was the dominant cannabinoid in their cannabis. So we provided them with a list of different cannabinoids that were available in the literature, and we found that CBD was more prevalent, which was 35.2%, followed by THC, and we also got the breakdown of different forms of THC. And Delta 8 THC was 18.3%, followed by Delta 9 that was 11.3%, and then Delta 10 that was 2.8%. We also inquired about the inhalation method, different inhalation method among those cancer patients who were consuming cannabis during the active treatment, and we found that joint, which is a form of cannabis consumption where they just use the cannabis without tobacco, that was more prevalent, which was 61.5%, followed by vaporizer, that was 21.8%, and then pipe and bowl. And we also asked about different edible or drink consumption method for consuming cannabis in this particular group, and we found that store-bought candy and followed by the baked goods were prevalent method of consumption by drinking or oral consumption. I came across this interesting infographic that I wanted to share with you all. It was published by Dr. Don Connelly, where he provided onset of effect of different forms of cannabis consumption, such as smoking, vaporization, oral, topical, as well as oral mucosal, and also the different duration of the duration effect that lasts in patient consumed by these methods. And it's very interesting that smoking and vaporizations, the onset is very short, but the duration is 2 to 4 hours. However, with oral, the onset is 60 to 180 minutes, and the duration lasts 6 to 8 years, so 8 hours. So there is a possibility of misuse when they consume by oral, because they would think that they're not getting the effect, and there could be a possibility that we're consuming more in order to get that instant effect. Now, some important points for discussion based on our findings. We found that 41% of our sample reported consuming cannabis, which align with the growing trend in the popularity of cannabis use among cancer patients for managing symptoms, as well as the adverse effects of different cancer treatment modalities. We found that there was a higher prevalence of cannabis use observed in the stage 4 cancer patients that indicates a potential link between the disease severity and the cannabis use. We also found that radiation therapy recipients reported higher cannabis use during treatment compared to those receiving chemo or immunotherapy. As of now, there is no direct comparison, any studies for direct comparison. However, we can speculate that radiation therapy is associated with localized pain, so they could be using cannabis to alleviate or manage the pain in that condition. And 51.6% of cannabis users during active cancer treatment did not have a recommendation from the healthcare provider, which raises concerns about access, education, and provider roles in oncology setting. We also evidenced diversity in cannabis product and consumption methods among our patient population, which necessitates tailored approaches as well as for individual needs of the patients. And we also found that many patients use cannabis multiple times a week or daily, which highlights the need for strategies to monitor risks and benefits that are associated with cannabis consumption during cancer treatment. I would like to thank you all for your time and attention. If you would like to learn more about our study or our findings, our principal investigator, Dr. Dennis Vito, is here with us today, so we can discuss after the session, as well as you can email us for more information.